You're listening to On Mission with Dr. Matt Davis, a podcast designed to explore the personal mission of everyday leaders. Hear from men and women who are making a difference in their corner of the world and discover what keeps them on mission. Welcome to On Mission. I'm Dr. Matt Davis. Our guest today is Dr. Sarah Urban, who is a faculty member in Maranatha's School of Nursing. And her first job was as a lab technician at an agricultural quality assurance lab in Illinois. I can't wait to figure out what in the world that even means. She enjoys hiking and reading, gardening, and sewing. Her favorite meal is a deep dish pizza, which, you know, I went to a deep dish pizza place in Chicago once, and it took over an hour for them to get the pizza out. But to you, that's acceptable?
Yeah.
Okay.
Well, it takes that long to bake it. So.
Yeah, that's what they said. I was complaining. They said, that's how long it always takes. Mm-hmm. I thought it was something unusual. She has been a nurse for 14 years and worked in nursing education, in teaching and leadership roles for over 10 years. And we are so thankful that God called you here to Maranatha this year. And she is a great blessing. Sarah, welcome to the podcast.
Oh, thank you.
So some people's first job was like McDonald's or, you know, something that everybody knows about. But yours was a lab technician at an agricultural quality assurance lab. So what is a quality assurance lab in the agricultural context?
Well, basically, they're testing seeds like your corn, your soybeans, what you see growing out in the fields. They have to test it to make sure, like, is that specific hybrid okay as far as like, does it grow? Does it germinate?
Yeah.
You know, do the seeds look okay? So this lab would do testing on their different batches of seeds. And
so it's on the plant side of the agricultural world, not the animal side.
Yeah,
okay.
the plant side, for
All right.
sure.
Well, but you're a nurse. So how did you get hooked up with that? Like what point was this, in college or high school or when?
Yeah, so right before I started college and then through college during the summers, I worked there. My dad works there. So, kind of.
Nice. Got you in on the ground floor.
Which was definitely helpful, and then through college, I did a few different jobs, housekeeping, library, and then eventually became a nurse, so it all ties in.
So how did you decide that nursing was the profession you wanted to pursue? Did you have a nurse in your family or what was the direction there?
Yeah, really, I don't really have many nurses in my family. My sister-in-law's a nurse now, but really at the time, I'm like, I think I just want to do something to help people. So I like history. So I'm like, well, I could go into teaching. I thought about home ec for a while, which I'm like, okay. Then I'm like, well, nursing's a good job to help people. So, that's kind of where I got started with that. And then I think really in college, once I actually got into the nursing classes, doing clinicals, going to the hospitals, I think that's really where I really developed a passion for, this is really a ministry where I can help patients and help people with my career.
So right away, you were thinking ministry. You grew up in a Christian home. Mm-hmm. And what you said your father was in this laboratory, and that was in Illinois? Mm-hmm. Okay, so I grew up in Illinois as well, and it is the most fertile ground, I think, anywhere in the world. My uncles and grandpa, they were all involved in the agricultural world and farming. And, I always had the impression as a kid that it was easy. You just planted the corn and the corn grew, But then you see the amount of work that goes in behind the scenes and even all the science that's involved in that. And, of course, the economics and all of the business aspects of the agricultural world. And literally, I think in the Midwest of the United States, we are like feeding the world. It is the most fertile ground, and it's interesting. So you kind of grew up in that same sort of rural environment. There's a different set of values, I think, in rural communities as well. And so you came out of that really with a heart right away, like I want to do something to serve. Mm-hmm. And you saw the nursing profession as an opportunity to do that. Mm-hmm. So where did you go to school? How did you pursue that?
Well, I went to Pensacola Christian College for my undergrad, and really finishing my undergrad, I was like, I feel like I need more preparation. So I actually went right on into my master's degree. I did a grad assistant program, which is a really fabulous way to help pay for school. I got hands-on experience teaching, so that was a really good experience to get that. And then I actually stayed on there for a couple years as faculty too, really just getting into teaching. And I think that's where I really kind of developed my love for nursing education. So like I see myself as a nurse, but then my specialty is nursing education.
Right.
You know, every nurse kind of has their own specialty. You know, do you work in surgical nursing, ICU, emergency, you know, so I kind of see my specialty as education specifically.
So before we get too far ahead of ourselves, I guess, you know, this is the On Mission podcast. And so the sort of deep question that we hit our guests with right in the beginning is, what is your mission in life? You know, how would you articulate that in terms of guiding your decisions or the path that you found yourself going down? What is that mission that you have for your life?
Well, I think I kind of already touched on it a little bit, but really my mission is glorifying God by helping people and then just really making a difference in the world.
So we hear pretty frequently from Christian leaders that aspect of glorifying God in the profession that they've chosen. And I don't think I've had anybody from the nursing profession on the podcast up to this point. This is season 8. And so we finally, you know, got a nurse to talk to. And yet it seems really perfectly aligned with that aspect of service. And you talked about glorifying God by serving others, and especially in this role as a nurse educator. The nursing profession, like, give us kind of the particular aspect of what it's like to be a nurse, like in the real world from your perspective. What is the schedule like? What is it really like? Because people think differently. Maybe even you did before you got into it, not necessarily knowing a nurse. But what does the real world occupation look like in the nursing profession?
Well, I would say being in nursing, there's so many different opportunities. You know, you can work in a hospital, you could work in a community as a community health nurse, you can work in people's homes, you can work in a school. So there's so many different opportunities. I would say in the real world as a nurse. Sorry, I was up late with the students at clinical last night at the
Imagine
hospital.
That, right?
So
it's part of that real world as a nurse.
Yeah. So it's definitely challenging because you're working with people, you know, and sometimes if people are ill or they're stressed, which most of the time they are if you're taking care of them as a nurse, you know, sometimes you don't always see the best side of people. But at the same time, it's just a fabulous opportunity to minister and be a blessing and just help them maybe feel better about the situation, help them feel comfortable. So really, when we're thinking about nursing, we're kind of going through a process of assessing the situation, assessing the patient. We're taking care of the patient, so we're giving medications, we're doing procedures, we're just monitoring that patient. Maybe if it's at the hospital, we're monitoring that patient throughout our shift. And really, when we think about nursing, a lot of times people think about, oh, they just do what the doctors say, you know, but it's really kind of more than that. A lot of times as nurses, we're the ones watching for changes with that patient, picking up on those changes and letting the doctor know, hey, this is going on. Hey, can we order this for the patient? You know, and really it's a vital role kind of keeping those patients safe, especially in the hospital setting.
It seems like there's a real balance of what might even seem like disconnected characteristics that you have to employ every single day and balance, because you have to be precise. I mean, there's an element of mathematics that goes into it in putting together dosages and making sure that you're, you know, giving the right medications just exactly as they were ordered, because you get that wrong. If you get that decimal point in the wrong place, then that's a bad day for that patient, worse than they're already having. And at the same time, with that sort of clinical precision, there's also the people side of it and the bedside manner, so to speak, where we have to not only keep this person alive, which is my simplistic definition of nursing. These are your patients, keep them alive.
Yeah, that was a good goal, right?
Yeah. You know, it's not always achievable, but if you do that, you'll have a job tomorrow. So we have to keep them alive. We have to do that precisely. But then there's that human element to it that means so much to people that are in really the worst situation potentially of their entire life. And you know, someone who's really good at math and the precision of all that may not always be the person that we think of as having the most engaging personality or empathy, but nurses have to have it. They have to have both, or you really won't be successful for long, will you?
Yeah, and a lot of times as a nurse, we think about caring for the person holistically. So we're taking care of the person, physically. Obviously, we want to keep them alive. That's always helpful, or, help keep them comfortable. That may be the goal, perhaps, if I'm taking care of someone who is getting ready to pass away. But then we're also taking care of that person emotionally. We're taking care of them spiritually, psychologically, psychosocially. So a big focus now is on their social determinants of health and looking at, what's the big picture economically for that patient and how can we help that patient, if they're in the hospital when they go home, and help educate that patient. So you're really looking at the patient as a whole person and not just the physical side of things, which, a lot of times that's what we think about with nursing, like, oh, they're giving medications or they're doing a procedure, taking vital signs, but it's really more than that because you're taking care of the person as a whole.
My dad recently was in for a procedure, and we saw firsthand how, the neurosurgeon that was going to perform the procedure was maybe a minute and a half in the room ahead of time. Now, he has a big job behind the scenes once they get into the operating room, but we didn't get to interact with him very much. We didn't get to see him very much. But the nursing staff that took care of my dad beforehand and afterwards, they were like a lifeline to us because we were so hungry for information, and of course you're worried or nervous about how is this going to go, and you've never been through this before. This is your first time through that. But for this group of professionals, they know all the things you don't know. That can be good, that can be bad. They know the good, they know the bad. But how they helped us through that made such a difference. And I won't say more than the surgeon themselves, but it certainly was to us as family members something that was of great comfort and helped us through a very, very difficult time otherwise, of uncertainty, of not knowing, of worry, of anxiousness. And I don't think that showed up on the bill from the hospital, right? Like that part of the service, that part of their ministry, if I put it in that context, it wasn't charged. Every other thing was charged.
Yeah, I'm sure.
From the liner on the thing to the aspirin, every little thing was charged, and they definitely itemized that bill down to the nth degree. But empathy and compassion and time, just understanding that I need to be here and be present and be consistent and get to know these people's names and treat them like human beings. It doesn't cost anything, but it can make all the difference, right? So to me, we're beginning to define sort of the parameters of what that means to be a nurse, that is a successful nurse, even in a secular definition. But what I really want to talk about is how a Christian approaches the profession differently. What are the unique aspects of your faith that inform or direct your practice in that particular profession? Are there some things that stand out to you in that, to sort of answer that question, that issue?
Well, and I feel like nursing is kind of a natural fit because you're taking care of the whole person, and you're ministering to them spiritually. Even if you're in a setting maybe where you don't have the opportunity to share the gospel or anything like that, you can still be with the person. You can still pray for your patient and be an encouragement and a help. And I think, too, it gives you that purpose, knowing that it's a calling, because I worked in secular education. I've worked with different nurses in different hospitals and different settings. And I think there is that difference with Christian nurses that I've seen. And, it kind of gives you that deeper purpose, gives you that bigger perspective of the patient as well, versus someone who's maybe not a Christian. And I think from a Christian standpoint, I feel like nursing is a valuable profession to be in because you have that opportunity to really make a difference. Even if you don't get a chance to share the gospel with every patient, you get a chance to be that testimony and be a blessing to them.
How do you balance well, let me ask it this way as a foundation before I get to my next question. Lawyers, you know how they go. Oh, yeah. And you're not on the stand, all right? I'm not going to grill you. But I guess, are there aspects sometimes especially in a hospital environment or in a healthcare facility, that actually limit what you would otherwise like to do as a believer, that put maybe some pressure or some tension between what you're being asked to do or not do versus what you feel like are your Christian values?
There definitely can be limits. Most, as far as like ethical responsibilities, most places have in place if you have like, if you have a conscientious objection to participating in a certain procedure or something like that,
Sure.
but generally when we're thinking about it, it's more of a factor of looking at what their policies are. Maybe in that particular state or that particular healthcare facility. Are they a religious-based healthcare facility versus, more of a secular-based facility? Some facilities, like, for example, like your Catholic-run organizations or Lutheran or different ones, they may be open to praying and they may have more chaplains available, and that may be something that's more the norm at that facility, whereas other facilities that would be seen as something that would not be appropriate, and I think as a Christian nurse, it's important to understand what's acceptable at that organization and then also what can be appropriate. If the patient leads the conversation, is that okay? A lot of times it does come up. Like, for example, if we're admitting a patient, one of the things that we ask them about is what's their spiritual background. And sometimes that even means, okay, maybe their background that's not a Christian background, but can we still help that patient? Like maybe they're a Muslim, but, do they want their spiritual leader to come in and meet with them? And we can still facilitate that and promote their spiritual health indirectly. And it's an interesting role, and it's something I think that comes with experience too, and kind of, okay, what can I do, what can't I do, and I think it just really does depend on where you're at.
There could be some tension there because we do know that biblically we're supposed to be aggressive evangelists. I mean, we have the truth, and that's exactly what is going to make a big difference even in these situations. As a nurse, anybody in healthcare, you are interacting with people at their most vulnerable moment and many times at the point of life and death. And this is the truth that they need to know and hear. And yet it may be very frustrating if you find yourself in a limited environment where you've been asked not to overtly introduce a religious conversation, right? Or give the gospel in a direct way without being invited to do so, certainly. It can be frustrating, I'm sure, to feel that your workplace is limiting your ability to give this person what they really need. At the same time, creativity will open doors that would otherwise not necessarily be open. And I think that's where I have noticed sometimes, I've just personally seen, I think sometimes Christians choose conflict over creativity.
Yeah.
When they could have arrived at the right and the different place without necessarily just going in like a bull in a china shop and rather bringing a conversation around and doing that in a creative way and still yet a very intentional way to be a gospel influence. When Dr. Marriott was in the hospital recently, he had a 4 or 5 day stay and in the intensive care. And he found himself over at one of our specialist hospitals, and he didn't know it when they checked him in, life flighted him over there or whatever, that it was a Maranatha nursing school graduate who was the charge nurse on that floor. And she was in charge of all the ICU, and she graduated 7 or 8 years ago when Dr. Marriott was still the president. And when he saw that, it was like, oh, this is incredible. Like we're seeing our own graduates in action and then, saving his life, that was, maybe I'm overstating, but that was such a comfort to them. And they got a chance to interact with, but what they saw was also the respect that young lady had amongst all her peers. She had really an outstanding reputation professionally, first and foremost, to earn the respect, and then had been recognized and put into that leadership position because of it, but yet without compromising her testimony. And that's really the key, isn't it? That we have to balance that professional competence without necessarily laying aside our Christianity, right?
Mm-hmm.
I had a lawyer one time, a Christian lawyer, who was doing something I couldn't believe he was doing as a believer. And I questioned about it privately. I said, man, how can you do this? You're a Christian.
Yeah.
How could you sue a church? He was suing a church. And I said, what are you doing? He said, hey, I'm a Christian and everything, but I'm very secular about my work ethic. And I thought, well, that's not very Christian.
No.
Because we're not called to be secular about our work ethic. We want to be competent and professional and, follow the rules of the guidelines of the workplace, the culture, et cetera. But we still have to be creative, don't we, at bringing and living our faith. And if we will, I'm sure you've probably seen examples where that actually opens doors.
Yeah, and I think just with your lifestyle, because people see that, working even in higher education. I worked in secular higher education institutions, and people will see that like, oh, yeah, you don't talk that way, or, oh, you don't drink, that type of thing. And I think, they see that in your lifestyle, even if you're not, maybe aren't allowed to overtly share the gospel, they see that in how you're treating them, how you're acting, and I think even that, can be a testimony for sure.
Oh, absolutely. Now, how do you handle the stress of the profession as a believer? Is there a difference in how you cope with the very difficult big picture questions, but also just the stress and the pressure of the profession? So maybe describe what that pressure is like, where those stresses come from, and then your own perspective on how a believer handles that stress, those pressures differently than maybe some coworkers.
Yeah. I think it really depends on the area of nursing you're working in, but just seeing the different psychosocial situations, like working in pediatrics, maybe you're working with victims of shaken baby syndrome, or in the adult setting, people who have been abused or people who have tried to take their own life. And I've had all those different types of patients before, and that's really difficult to deal with. Maybe you're taking care of a patient who passed away, they're young, and then you have to turn around, go in the next room, and be encouraging to whoever your next patient is. And that can be really challenging. Some of that does come with experience, and just learning to deal with it in the situation. But I think as a nurse, really coping, it's trusting God, praying. A lot of times as I'm going through the shift, it's like, give me the words to speak to this patient, or, let me do this safely. And, that's important. Spending time in God's word, and then just spending time on your own as well when you're off, praying or doing something relaxing, cooking, spending time outdoors, something to kind of refresh yourself.
Yeah.
So I think that's important to spend that time, and then keeping it in perspective as well. It's one of those jobs that even though it's challenging, you find what's rewarding. So, hey, I was able to help this patient and they were able to feel better and go home, even though there was this other hard situation with this other patient over here. And one of the challenging things that we hear about, especially in nursing now, is burnout, compassion fatigue, and people just really kind of depleting that reserve and being able to, their resilience and being able to deal with those types of situations. And I think as Christian nurses, especially, we kind of have that perspective to draw on where, yeah, we know it's a challenging job, but we also know where to get help. And I think that kind of gives us that extra background to be able to be resilient and, I guess, survive the job, basically.
Well, isn't it interesting how two people can face the same pressures, the same circumstances, and one of them is just an absolute mess and a puddle all the time, and the other one just seems unfazed. But I would guess that given the fact that empathy is such a core, essential element of your profession, that in and of itself becomes a challenge over the long haul, because you do deal with so much loss and so much pain and suffering and so many losses along with the wins, because none of us get out of this life alive, right? I mean, at some point we're going to meet our maker, so to speak. But when you have a faith reserve to draw from, that gives you a different perspective on death, certainly. But that empathy, it's almost like intentionally allowing yourself to be touched with the true depth of the situation that your patients are going through, while at the same time not allowing it to accumulate as you go from one room to the next room to the next room, and one day to the next day to the next. And I can see how even in the legal profession, the same thing was true. There were guys that were so jaded and so calloused to the feelings and the emotional difficulty of what their clients were going through, they couldn't even recognize it, right? Like, to them, this lawsuit is interesting, and it's a professional challenge. And if they win, they're on cloud nine, and if they lose, it's on to the next case, and the client ends up paying the price, right? Those guys aren't very good lawyers. At the end of the day, they're not really helping their client. In your case, that might be a survival mechanism for you personally, but it isn't going to make you a very good nurse, is it? You've got to almost intentionally stay sensitive and yet not allow it to accumulate. And I don't know how to do that. I mean, it's got to be the kind of grace that God gives on a daily basis to those called into that profession. But that would eat me up, and I'm sure you've seen that fatigue. Yeah. What did you call it?
Compassion
fatigue.
Yeah.
Interesting. And so for the Christian, we have to have compassion, and it is almost overwhelming, and yet you're able to kind of navigate that world without allowing it to overwhelm you. And I guess that's just the grace of God lived out, huh?
Yeah, for sure. And keeping it in perspective too. Even working with students, it's like I try to keep in perspective, like, okay, this is their first time doing this skill, or their first time doing this with a patient, and kind of keeping that perspective all the time is important as well, which can be definitely challenging without God's help, for sure.
So pretty early on, you identified education was what you wanted to pursue as well. And I'm curious how that was clear to you. How did you have some confidence that you wanted to go, not necessarily in the active practice of nursing, but rather get into the educational side?
So I love working as a nurse as well, but I also love teaching, and teaching is part of nursing. We're always teaching patients, teaching new nurses. But I think for me, it was something I was interested even back in high school, which is interesting because I was homeschooled all the way through high school. But just, helping my mom with my younger siblings, it's like I really enjoyed helping them learn as well.
Are you the oldest or what?
Yeah, the oldest, yeah.
All right, so you were like mini mom in that sense, right?
Sort of, not quite, but almost, I guess.
Usually that's how it works out.
Yeah. So I just was interested in that, and then going through nursing school, it's something I might be interested in. Did my master's in nursing education. And that was just something, it's like I really identify and enjoy doing this, and even though I enjoy working as a nurse, and obviously I've done that as well, being in nursing education, to me, it's an opportunity, it's a privilege to really make even a bigger difference because, as a nurse, I touch so many patients' lives, right? But as an educator, I'm touching the nurses that touch even more people's lives. And it's a responsibility for sure, but it's also a privilege and an honor to be able to serve in that way as an educator, and then also in some leadership roles I've had supporting other educators as well. It's like that even higher level of being a blessing there.
Now, don't take this the wrong way. I hope I won't say this the wrong way. But I have noticed, I've made some observations over the last, 20 years in higher education, that the School of Nursing in particular, in lots of different colleges, maybe every college, is particularly stressful, particularly rigorous. We'll use the word rigorous academically, time pressure. It seems like they have to grow up a lot faster almost even than the normal college student developmental cycle. And this is the part I'm concerned how I say this. There's usually a little bit of drama that comes from that. Yeah. And I'm not just talking about at Maranatha. My mother-in-law was the head of nursing at a community college where they had a nursing RN program. And it was the same thing. It was like, there's always this tension or flow over of personal life and academics and professional. And it seems like it's all just like two waves coming together from different directions all the time. And it's very formative because of that, right? in ways that perhaps don't normally happen in other professions until graduate school.
Mm-hmm.
But the nursing profession tries to get it all done in the bachelor's program. I mean, it's mostly, there's the RNs where you can do that in 2 years. There's a BSN and 4. It's actually kind of rare. The only reason you'd really get a master's in the nursing profession would be to go into education primarily, is where I see that. The MSN is primarily used in that because, you can make a good living with a BSN and your whole career be at that level. So am I observing that right? And how do you deal with that sort of life and death pressure that's hanging over the preparation aspect? Because now it's not just about your personal practice, but it's taking that student from wherever it is they came and preparing them to go out and keep the patients alive and deal with them and pass that NCLEX, which is like looming over their futures. That's a lot of stress. And I think that's where probably the emotional aspect comes from, the dramatics that come together in all those different forces and pressures. Am I right to say that nurse education is really of a different order and magnitude than maybe even some of the other professions that we have here at the college?
Yeah, I would say probably than most of the other professions here at the college. And one thing that we think about is we're preparing them to be a whole professional. So again, you have the part keeping the patient alive, but then caring for the whole patient. How do you behave as a professional? We're going out, like I was out the last couple of days with students in the hospital, and the students are taking care of patients and they're documenting in the patient's record. And, and I'm there to basically keep them safe and help them learn, so it's challenging, I think, from that standpoint, because they have the academic piece, which there's a lot to know just generally for nursing, but then they're also developing as a professional, and I think that's where the nursing program, even though other programs do that too, with the nursing program, they have that hands-on piece where they're dealing with all the different pieces of the nursing profession, and then for the bachelor's degree program especially, then they're getting that background. For example, I teach nursing research, so they're getting a little bit background in research. How can they use research in their practice? They're getting more background in community health, so how are they taking care of patients in different community settings? So they're getting that background. And then going on for master's, there's education master's, but then also a lot of students now are going on for their nurse practitioner, because those roles are becoming more popular. Nurse midwife.
That's a force multiplier. And you mentioned earlier the economics, which, that could be its own doctorate degree in healthcare economics.
I think there probably is one out there.
Got to help whoever is going down that road. That is complicated. But that plays a lot into the care that people receive. And you alluded to it, but there are some maybe ugly realities of, what kinds of health care is provided to different people in different economic brackets and categories, and what kind of insurance they have, and navigating that whole world is very complicated. And that nurse practitioner, and then on the other side of it, the physician's assistant, those positions are highly trained professionals that help multiply the practice of a doctor, and they can even have their own practice now, right? The nurse practitioners.
In a lot of states, it depends on the law for that.
See their own patients and prescribe, things, and that's a very interesting path. And the nurse practitioner starts with the BSN, right? And then you move into a professional doctorate.
So they get their master's degree. In most states, they can get their master's degree and become certified as a nurse practitioner. And then there's also a practice doctorate or DNP degree that they can get. So nursing doctorates, there's either the DNP, which is like a practice-focused doctorate, or the PhD, which is a research-focused doctorate. Some people go on for like an educational doctorate. There's, like, for example, I have my doctorate as a PhD in nursing education, which is more of a research education focus. So
okay, that was going to ask you about that. So you go on for a PhD in nursing. So, we normally think of doctors and nurses, but you are a doctor nurse, which is interesting in and of itself. But it isn't an MD, like a medical doctorate. It's a PhD in nursing education. So are the classes education classes or nursing classes, or a little bit of both?
So some of them were research type of classes. Some of them were nursing education. So I did my program online. So they were focused more towards online education, like instructing online classes and things like that. So that was my specific specialization. But then for my dissertation research, I could kind of pick the way that I could go with that. So I actually did my research related to compassion fatigue and burnout and how that related to reflective practice in nurses. So I kind of took that in a different direction because at the time I was doing my PhD, I was actually working as a nurse and not as an educator. So, I'm like, okay, I'm going to do what's relevant to my practice right now in Florida, where I was working at the time.
So because of the fact that it's such a real world application and because you are preparing them for licensure and immediate employment in the field, the nurse education programs involve a heavy practical experience piece. Mm-hmm. And why don't you describe a little bit of how that unfolds throughout their academic career and what the magnitude of that looks like in terms, because I think the only other profession that has even close to that kind of practical experience in the bachelor's program would be like the School of Education, where they do a student teaching and some observation ahead of that. But even that, I think, is different apples and oranges to what you guys do with your clinical practice. So how does that unfold throughout the academic career, and what does it look like?
Yeah, so our program, just like most nursing schools, you're doing some prerequisite classes, science classes, maybe a few nursing classes to kind of get that foundation. And then typically once students start the actual nursing program, so they're starting their fundamentals of nursing course, basically before just, hey, you're going to go out to the hospital tomorrow, we teach them skills in lab. So usually they're in lab for maybe 6 weeks, 7 weeks, where they're going in and just learning basic skills. And then we have them start going to clinicals, which is basically they're going to a healthcare setting with an instructor to kind of help supervise them and help them learn those skills taking care of actual patients. So our students here start at long-term care, then they go to the hospital, and then as they go through each of their courses,
what year
they're
is
doing
that
clinicals.
That they do their first hospital experience?
So for our program, it's the junior level. So
Okay.
Junior and senior levels where they're really in the nursing program and doing those experiences. And then as they progress through each of their courses, they're doing so many clinical hours, either in a hospital or another healthcare setting, usually with an instructor. And then their final semester of their senior year, so I'm working with the seniors right now. So next semester, they'll be doing a preceptorship experience where they work one-on-one with a nurse. So it's almost like an internship type of experience. But really throughout all these experiences, they're hands-on taking care of patients. Now I build things up. So my seniors this semester learned IVs. So they're really excited about that. How do we take care of IVs? How do we start IVs, give IV medications? So at clinical these past few weeks, they've been starting to do
Thank
those
you for
with
listening
actual
to On
patients
Mission,
after
a
practicing it
podcast
in the
produced
lab.
by
So we always have them
Maranatha
practice the
Baptist
skills in the
University.
lab.
No matter
And then
where you
hands
go to
on
school,
clinical.
you're going to face the
humanoid
enormous
simulator,
social
your
challenges of
android
our
that's
world
in-
today.
Yeah, our mannequins.
Where do you
yeah.
want to go
okay.
through
So-
that
and those
developmental
things are stinking
process?
expensive. I've seen the
A
bills
place
on
like
those.
Maranatha,
Oh, yeah.
designed to
But
affirm
it's
your
much better to
faith and help
practice
you
on that,
think
because if you get it
biblically,
wrong,
or a
you
secular
just hit
college
reset and try
dedicated to
again, right?
godless
Yeah.
instruction
I
in
remember
a
talking to
God-free
the,
or truly
ROTC guys talking about how
anti-God
they train
environment that
medics,
offers
and
no hope,
they said if you
no
accidentally
joy,
kill the simulator,
no
they'll make
faith,
you go and
and
dig a
certainly
grave. And I
no
always thought
peace.
that would be very motivational
At
not to do
Maranatha,
that ever again.
you'll be surrounded by
I don't
friends
think we make
who have
nursing
also
students do that. There'd be a
chosen
lot
the
holes
path
out on
of
the ball
truth
field, you know what I mean?
and
Yeah.
faculty who devote their lives to
But they get
service.
that practice. they
Maranatha
start to
is
build up
more
the
than a
confidence
Christian
level, maybe
college.
A little nervous about it.
Find out more at
Nursing is a hands-on
mbu.edu.
profession, right? And you got to
And
grow
for
up
more
fast. You gotta
information
get over
about our
the-
podcast
the
guests and to listen to
grossness
all the
of it or
previous
the,
episodes,
the different
visit
aspects of it, so social. And just be willing
mbu.edu/podcast.
to do whatever it
Join us
takes to
again
help
next
that
week
person
as
in
we
their time of
examine
need.
what
And
keeps
they're
leaders
actually
on
doing
mission.
that hands-on throughout the junior year, the senior year. And did you say you got back after midnight last night from clinicals? So these things
Yeah.
are going late. I mean, that's a long day.
Mm-hmm.
I think business students would just die if you ever asked them to do something like that. And so it really is a different profession. It's sobering. And right away they start to realize, okay, this is a different path. And because of that, I'm sure there's people that maybe got into it thinking it was one thing and say, maybe this isn't for me. There's some alternative options. And you alluded to the fact earlier that there's all kinds of different places where you can practice as a nurse.
Yeah.
What does that variety look like? You know, it's not all just ICU or trauma unit or emergency room. I mean, it's not even all in the hospital setting.
Well, within the hospital, you know, you have your emergency department, ICU, you have medical units. So there's different acuity levels. Maybe if they're interested in maternity or pediatrics, there's those opportunities. But then even in the community setting, you know, there's nurses in clinics, there's nurses in schools, occupational health, public health. So we think about like a health department, there's nurses that work at the health department. Schools, like so at Maranatha, we have nurses that work here with the students, you know, working in different, like the Army, there's nurses, medics there. You know, so really any area of healthcare, you have nurses. Healthcare leadership, so a lot of nurses are chief nursing officers. They're in leadership roles in different healthcare settings. Case management is another area. You know, nursing education. So there's so many different areas where nurses are really touching in healthcare. And I think that's one thing that students get, we expose them to a lot of those areas in nursing school because we're kind of preparing them generally. And then when they get out and graduate, then they're going to get more of that specific training. So let's say they go directly into ICU or directly into like NICU. They're going to get more of that specialized training when they're on the job as well. You know, and I think that's what's unique to nursing is you're always learning and you're always getting that training where you need it if you're working in different areas. And the nice thing too is that you can switch positions. You know, I've seen nurses, they worked in the hospital for years. They're like, I can't do this maybe physically anymore. But they'll go into maybe home care nursing where they're working one-on-one with a patient and they're just there all day. You know, it's a little bit more low key, you know. So it really is just wherever you feel like you're led to be. But then even just keeping an open mind too is helpful. Like when I was in nursing school, I'm like, I want to do pediatrics. I've never done pediatrics. I'm like, I never want to do ICU. I ended up working in step down ICU and loving it, you know. So you just never know. And I always encourage my students, you know, keep an open mind. You know, even within the field of nursing, there's so many different areas, even things like legal nursing. Being a legal nurse consultant, that's a good, interesting area as well.
I don't even know what that would be for cases where you talk about, okay, here's maybe a malpractice case and the lawyer doesn't have the medical expertise. Interesting.
Yeah, so there's so many different areas. So that's what I love about nursing too is, yeah, it's a profession, but there's so many different ways you can go with it that are similar but different. So.
We talked about your mission to glorify God, and that is a long-term vision. That is a life's work, right? That we want to do that on a daily basis, but that those days accumulate into a lifetime. And someday our goal is to stand before the Savior and hear, well done, thou good and faithful servant. And that's the ultimate goal. I want to close with the question, what do you find rewarding in the experience of being a nurse educator? And, you know, what does it look like for you when you say, man, this is making that really worth it? You know, there's a lot of stress. There's long days like yesterday. There's early mornings like this morning following right directly on. And there's a lot of stress and maybe even some drama. What makes it rewarding for you? What is it that you see the short-term success? We talk about the long-term. And we always have that in mind. But where in the day-to-day do you find that satisfaction and reward?
I think just helping students and just seeing those light bulbs come on, you're helping them kind of really understand. I think especially in clinical, it's challenging. But like maybe they got a chance, like some of my students got a chance to give IV meds for the first time or try to start an IV for the first time or doing different procedures and just seeing the light bulbs come on. You know, where they're like, oh, I actually have to do this. Or, oh, the nurse is actually doing things when they're looking at the patient. Like, yeah, they're seeing things that are happening with that patient, you know, and just helping them really connect the dots. And then it's rewarding too, like you mentioned, seeing Maranatha grads at the hospital, you know, just seeing students that have graduated working at the hospital, maybe my former students or even former students that I've had that are now educators. It's like, okay, now they're teaching. And I had that that person as a student at one time. Hopefully I didn't traumatize them too much.
Right.
But, but it's rewarding seeing those results of how your practices kind of played out.
And it can be amazing to think back when they first started, before they knew anything about the profession, and they were just raw material, showed up, maybe enthusiastic and excited, but having that chance to mold the students and direct them and advise them, and to watch as God works in their own lives, and then go out and serve Him faithfully as well. Leaders duplicate, and that's what education is really directly about. Thank you so much for your role here at Maranatha, your leadership and commitment to the students. Your professional expertise is obvious, but behind that, the heart, the compassion, the willingness to remain vulnerable and empathetic, not just for your patients, but for your students. It means so much, and I appreciate that. I'm glad also that you took the time to sit down with us today and share some of that. I know it's not easy. It's not necessarily in our comfort zone, but I know it means a lot to be able to provide that example to another generation. So, Dr. Urban, thank you so much for your time and joining us on the podcast today.
All right, thank you.
Thank you for listening to On Mission, a podcast produced by Maranatha Baptist University. If you're like me, the parent of a teenager right now, it seems the world has gone mad. Anti-God ideologies and liberal political philosophies dominate higher education. You're probably asking yourself, is there a college I can trust to build on my family's values in a biblical worldview? Thankfully, there is such a place. Maranatha Baptist University in Watertown, Wisconsin is dedicated to training young people to serve the Lord. MBU provides a safe environment to study, practice, and grow their faith, and develop lifelong relationships with Christian young people that share their biblical values. And you don't have to compromise one bit on the academic quality of your education to receive it from a Christian worldview. Find out more at mbu.edu. For information about our podcast guests and to listen to all the previous episodes, visit mbu.edu/podcast. Join us again next week as we examine what keeps leaders on mission.